Hey there, this is a video relating to the differential diagnosis and the pertinent questions to be asked for nausea and vomiting. So, first, the differential diagnosis. Let's go from top to bottom. I mean, top to bottom. So, first, neurological causes. So, in neurological causes, it can be meningitis, it can be increased intracranial pressure, or it can be any infection of the brain or meninges. So, we have to ask the questions here which are pertinent and which we have to ask are headache, stiff neck, vertigo, focal numbness or weakness. Vertigo, and then weakness, numbness, tingling anywhere in the body or in your limbs. Next, think about psychiatry. So, in psychiatry, we have A, B, and D. C comes next. And then again D. All right. So A is alcohol, alcoholic patient. B is bulimia or anorexia, basically eating disorders. Just for the sake of the mnemonic, I put it as B, but we can even write eating disorders as the diagnosis. D is depression. Another cause of vomiting is hypercalcemia. And diabetes mellitus. Okay, next, let's go down. Neuropsychiatry is over. And let's come to gastritis, GIT causes. In GIT, it can be gastritis, and it can also be GERD, or it can be POD if. Next, genital and urinary. So in genital, it can be just think pregnancy. That is a very important cause of nausea and vomiting. It can be hyperemesis gravidarum. And then in urinary causes, you will have nephrolithiasis, acute pain. We have other causes in GIT, which I'm going to mention later. Okay. Other causes. An easy way to remember this. Now let's move on to the mnemonic. In order to make it simple, I'm just going to modify the OFDP LICRA. That's it. So the mnemonic is onset, frequency, duration, progression, previous episodes. Instead of L, we are going to have C, I, Q. So in C, we ask whether character, we ask projectile or non-projectile. If he says projectile, then we ask everything about neurological. Have you had any headache, stiffness, vertigo, weakness, numbness, tingling? That's how our answer goes. That's how our questioning goes. Next, intensity is how much, and then quality is color, odor, and content. What is it? Is it just water, or do you have food particles? And associated symptoms, then any aggravating or relieving factors, and then associated symptoms. In associated symptoms, you ask Like how our mnemonic was fits all throughout now instead of food you can also keep alcohol. It's very important. So any relation, do you have any relation with this? uh, have you what type of food or liquid? And then it can be have you eaten outside? It can be gastroenteritis, right? It can be food poisoning. It's very important. One of the causes can be food poisoning. So we have to ask for diarrhea also, which will come down. And when you talk about eaten out, there'll be two mnemonics. Here there is alcohol. So you ask for any allergies. Do you have any food allergies? And eaten out will be infections again. Have you been exposed to someone with similar symptoms? Or have you been diagnosed with any conditions before? So, familial hypercalcemia is a diagnosis. So, exposed or diagnosed. Then we have travel or trauma, which holds good even here. Have you traveled anywhere recently? Or were you injured recently? Travel or trauma. And then taste, it holds good for taste. Any change in taste. Then you can also ask burning in your chest, dyspepsia. We are ruling out gastritis and also GERD here with these questions. Gastritis, comma, GERD. Next, after this, there was stool, right? So, do you have any associated stool changes? It's going to be mostly diarrhea. And if it's positive, we go in detail whether you have blood or not, how many times a day, and stuff like that. So, do you have any urinary complaints? That is what follows next. And then, along with food, this is very important. Do you have fever? That means it can point towards an infectious cause. And then, do you have rash, night sweats? Please here also ask burning in chest, also ask SOB, racing of the heart. This is very important. And sweating. Maybe it in if it is yes, then it can be chest pain. Or history of diabetes is important. That can come in past medical history because that's one of our diagnoses. So rash, night sweats, weight loss. This is also covered in our SORDF mnemonic. And then liver, yellowing, distension. Okay. So now after this, these are the main things. And also remember pancreatitis. So when we think about this, nausea and vomiting. And like I said, this is what GI causes of nausea and vomiting. Now the symptom is abdominal pain plus fever. So here we have our abdominal quadrants. And what are the causes of abdominal pain plus fever? It can be hepatitis, and it can be acute cholecystitis. Okay. Next, it can be ruptured ulcer. And then it can be gastroenteritis, appendicitis, and diverticulitis. These are the GI stuff that has fever plus abdominal pain. Now they also have nausea and vomiting. This can present with nausea, vomiting. This can present with nausea, vomiting. So can this nausea, vomiting, and diarrhea, and nausea and vomiting, and nausea and vomiting too. Now, pain of acute cholecystitis will radiate to right scapula, and pancreatitis can also be the cause of nausea and vomiting because alcoholic person, so we have to remember this. And this radiates to the back and improves on leaning forward. This is very important. Improves on leaning forward. If there's anything wrong with the spleen, then the pain radiates to the left shoulder tip or left scapula. All right, I think this is the video for nausea and vomiting. Yes, this is it. This is the video for nausea and vomiting. We don't have much differentials here, very few. And if you have to remember one more thing, it is hematemesis. The questions which we are going to ask are almost the same, but the differential diagnosis are going to be gastritis, bleeding PUD, gastric cancer, Mallory V stare, esophageal varices, and the only extra or specific question that we have to ask over here is for these two, bleeding disorders. So over here, the most important thing is coffee ground emesis. Coffee ground emesis. It's just going to be the same. The mnemonics that we are going to follow, the same fits mnemonic, but we going to ask for any liver disease, any bleeding disorder, or do you have any nosebleeds, and also are you taking any meds which are blood thinners. That's it. This is hematemesis. That's all for this video, guys. I hope you benefit from this. Thank you.